Okay, we're going to do a patient assessment for scene size up. We're going to make sure that we have proper body substance isolation. We're also going to check for any threats if the scene is safe. BSI, body substance isolation, gloves, if there's going to be blood, get some glasses on, safety goggles, something of that nature. Depending on the nature of illness, you may also want to consider a mask as well as a gown. What we're going to do is we're going to check the ABCs, airway, breathing, circulation. Good way to check for airway is you could actually just ask the patient, hey, I'm Blake, what's your name?
Amit.
Okay, so he can speak, but we can also come down here and just make sure that he's breathing properly, make sure that his airway is clean, that there's no blood or other items in his mouth. Breathing. Once again, he's talking, but we can also analyze the work that's taking to breathe. If he's breathing normally, his chest will rise and fall appropriately. He's not breathing quickly or slowly. And then as far as circulation, depending on the patient, you can check their carotid pulse, you could check their radial pulse. And then as far as circulation is concerned too, you just want to check for any serious bleeding. If there's any serious bleeding, then you're going to want to stop that. So head to toe exam, you're going to start right here. You're going to check his head, feeling for any deformations or any softness, tenderness, etc. You're then going to come check his ears for any fluid that may be draining. Check his eyes, make sure that they're pearl, that his pupils are reacting appropriately. Check his nose for any bleeding or other fluids draining. Check his mouth, make sure that the teeth are still in the way, there's no blood. Just check the bones in the face to make sure that there's no tenderness or loose bones. You're going to come back here and check his neck, check his veins in his neck to make sure there's no jugular venous distension. Check his trachea. I'm going to come in and check his shoulders, check his sternum, have him breathe, make sure that there's no pain there. I'm going to then come and check his abdomen, all four quadrants, upper left and right, lower right and left, check for there. You can check the pelvis, it's not necessarily recommended, but you can. Just make sure that it's strong through there. Check the groin if there's any serious bleeding, and then you're just going to come and check the legs. Make sure that you're adding counter pressure to make sure that if there's any fractures that you can feel that and they may have any tenderness. You're also going to come down and check PMS on both sides, so you're going to check their pulse. Can you wiggle your toe for me? Can you wiggle your toe for me? Okay. Check the pulse. Come back on the arms. Also counter pressure. Can you squeeze my fingers? Squeeze my fingers. And then check the pulse on both radials. Make sure that they're both good. As far as checking the spine, you're going to make sure that you take spinal precautions. You're going to make sure that you keep the neck in line. You can roll the patient, log roll them, and then you're just going to check the back for any step-offs, making sure that the spine is good to go. So one way that you can check for responsiveness, let's say that this patient is not responding to us verbally. To check their responsiveness, you can come here and just rub their spine, see if they have any reaction to that. Basically, it's just to measure their level of responsiveness. So pulse, a good way to do that is, once again, you'll come here to the radial pulse, and you can actually check that. You're going to count that for 30 seconds, times it by 2 to get their pulse rate. While you're doing this, you can also just feel the chest rise and fall of their breaths while you're counting that. You don't want to tell them that you're assessing their breath, their breathing rate, because a lot of times they'll start thinking about it and it will alter it. So you'll just count their pulse over 30 seconds, times that by 2, and then also count their breathing rate for for the 30 seconds, times that by 2. Alright, so the way that you can do patient history is sample. So signs and symptoms, allergies, medications, pertinent medical history, last ins and outs, and events leading up to the medical issue or the trauma issue. So signs and symptoms, you would look for maybe signs of what may have happened, as well as talk to the patient and ask them what kind of symptoms they're experiencing, pain, tenderness, whatever. Then you're going to ask if they have any allergies to medications. You're also going to ask if they're currently taking medications, and if they are, if they're taking that as prescribed by their doctor. You'll then ask for any pertinent medical history. Following that, you'll ask for last ins and outs, when was the last time you ate, drank, when was the last time you urinated, things of that nature. And then ask the patient what kind of events led up to either the medical issue or a traumatic issue.